Hi everyone, welcome. We will get started in just a moment. Thanks for joining. Hi everyone, welcome. Thank you so much for joining us today for NOAA's Climate and Societal Interactions Nature-Based Solutions webinar series, 4th episode, Utilizing Nature-Based Solutions for the Advancement of Multiple Objectives, Co-Benefits, and Health. My name is Aaliyah Mejias. I'm a Knauss Fellow with the Climate Adaptation Partnerships Program at NOAA. Next slide. And before we begin, some quick housekeeping notes. If you can hear me and see the presentation, you are good to go. We're excited to have live Spanish interpretation available today. To enable hearing Spanish audio, you can click on the headphones icon and select Spanish. To go back to hearing the English audio, you will need to select none. Unfortunately, we won't be able to support folks troubleshoot technical issues. We recommend rejoining the session if you have any issues connecting. You can submit questions to the speakers using the question function. And finally, this is being recorded. Next slide, please. Today, we'll provide brief overviews of our webinar series and the NOAA programs that funded the featured work. And the bulk of the time will be dedicated to our presenters to share their funded projects, and we'll have about 10 minutes for questions and answers. This webinar's, next slide, please. And this webinar series features projects funded by the Climate and Societal Interactions Division, or CSI, focused on the research and equitable application of nature-based solutions, which are actions to protect, sustainably manage, or restore natural or modified ecosystems to address societal challenges, simultaneously providing benefits for people and the environment. Each webinar episode will feature different projects to demonstrate the diverse contributions CSI has to the body of nature-based solutions research and practice of implementation, and provide time for the audience to ask the presenters questions. And each webinar has a different focus, so we hope you continue to join us each month. But today we're really excited to have so many registrants representing a variety of sectors with us today. With that, let's shift to my colleague, Jeannie Bay, to learn more about NOAA, CSI, and the Climate Adaptation Partnerships Program. Next slide, please.
Thank you, Aaliyah. Hello, everyone, and thank you very much for joining us today. We are thrilled to have you join for the 4th episode of our webinar series on NOAA's Climate and Societal Interactions Division's contribution to the world of nature-based solutions. My name is Jeannie Bay, and I'm a program specialist supporting the CAP program. We wanted to start off by first providing some situational awareness of where our division sits within NOAA. So NOAA is within the Department of Commerce, and the NOAA Climate Program Office is hosted under the Oceanic and Atmospheric Research Line Office. Next slide, please. The Climate and Societal Interactions Division within CPO supports research that seeks to generate the knowledge, tools, and institutional networks that enhance society's capacity to anticipate, plan for, and adapt to climate impacts. Our focus complements the work of the physical science research and development portfolio across NOAA by using insights from social science research to interpret, synthesize, and apply climate data analysis and observations. Programmatically, this is what CSI looks like today. It is a science policy research and engagement enterprise that brings NOAA to an emphasis on individuals and communities and the ongoing decisions involved in the process of adapting to climate, both here and abroad. So CSI is home to 2 unique programs, the Climate Adaptation Partnerships Program, formerly known as RESA, and the Adaptation Sciences Program, or ADSCI. So now we'll provide a little bit of background about each program within CSI to help you better understand the research approaches and the role that each program plays in the projects being presented today. So the mission of the CAP program is to advance equitable adaptation through sustained regional research and community engagement. We accomplish this by supporting a network of regional teams through competitively awarded 5-year cooperative agreements in multi-state regions across the United States. Teams are composed of experts and local partners working across a diverse range of sectors and with urban and rural communities and local, state, and tribal governments on their cross-sectoral climate adaptation needs. In recent years, the network has begun focusing more directly on equity and tackling the complex compound stressors, both climate and socioeconomic, faced by communities, and has also focused more attention on partnering with frontline communities. On the right of the slide here is our ring graphic, which depicts the CAP process. It is within these actions and outcomes that novel climate solutions are developed. The CAP program represents long-term investment toward this mission, as the program is over 25 years old, and our vision is to continue investing in existing regions and expanding into areas that are not yet covered by the program for the long haul. Next slide, please. So here's a map of our current CAP network of regional teams. The 13 CAP teams that make up the network are depicted in solid colors on the map. These teams have been working in their regions, some over many years, to build relationships and produce collaborative research and community-relevant adaptation approaches. We're working hard to reach full national coverage, but that is largely dependent on congressional appropriations. And in today's webinar, you'll hear overviews of projects presented by members of our Mid-Atlantic, Southwest, and Great Lakes teams. Next slide, please. So as I mentioned previously, CAP teams determine the research that they engage in alongside the communities that they serve, taking into account the unique environmental, socioeconomic, and cultural variables of their region. CAP approaches nature-based solutions work by applying this programmatic level lens of integrating social and physical sciences and considering complex compound hazards and benefits. This holistic lens allows for challenging more conventional approaches to nature-based solutions that may be solely focused on engineering and design, and rather emphasizes the importance of considering societal and community level variables. Significantly, CAP's work spans both coastal and inland communities, making our investments in nature-based solutions distinct from many other NBS-focused programs at NOAA that are concentrated in coastal zones only. The nature-based solutions work funded through CAP can be categorized into these buckets here, which include informing decision support and community planning, identifying trade-offs and co-benefits, advancing equity and workforce development, as well as analysis and evaluation of projects once implemented. More specifically, CAP has funded work developing community-wide green infrastructure master plans, examining the intersection of extreme heat, human health, and nature-based solutions, conducting vulnerability assessments for stormwater managers, and transforming vacant, neglected, and underutilized land into a matrix of green infrastructure, just to name a handful of projects. So from here, I will turn things over to my colleague Bhaskar from CAP's sister program, Adaptation Sciences.
Thank you, Jeannie. My name is Bhaskar, just like NASCAR. I co-manage a research program called Adaptation Science, or ADSci for short. As was mentioned before, the ADSci program is a sister program of CAP and was established in 2021. Three legacy programs, COCA, SARP, and IRAP, were melded together to create the current ADSci program. The goal of the ADSci program is to advance the knowledge, method, and framework to move society beyond incremental adaptation to a more widespread, connected, and transformative adaptation pathways. The two key objectives of this program is, one, to develop an understanding of key drivers and conditions that shape and enable adaptation. The second one being identifying and promoting opportunities for the use of climate information to support preparedness and planned adaptation. Next slide, please. The ADSci program prides itself on excelling at blending research, partnerships, and engagement. The ADSci supports work conducted both within the US, for instance, by co-leading the DOT partnership called Climate Smart Transportation, and outside the US by leveraging US Department of State funding on projects such as Island-Led Resilience 2030 and the NOAA's Blue Carbon Inventory project. ADSci also provides technical collaboration and capacity building by leveraging funding in areas such as fisheries, also known as the CAFA program, and coastal resilience. ADSci encourages and supports research that generate knowledge, tools, and institutional networks to enhance society's ability to anticipate, plan for, and adapt to climate impacts. In short, We take a systems approach and strategically look at compound events and their cascading impacts. We shape and implement our program priorities by participating in various federal work groups and project-specific cross-agency collaborations. A good example in the NBS space is the FEMA guide called Building Community Resilience with NBS, the Commission for Environmental Cooperation, a partnership between Canada, US, and Mexico. That effort was called Monitoring the Efficacy of Nature-Based Solutions, Proposed Methodology and Indicator. Now, NBS is a space that AdSci has invested in the past. Moving forward, we would like to focus more in this space by amplifying our investments in the future by using past work as a springboard. This complements NOAA's broader work in science, service, and stewardship. The program carries out this work by supporting a portfolio of interdisciplinary research and focused partnership. Over to you, Leah.
Thanks so much, Bhaskar. I appreciate those overviews. So as we know, adapting to climate change requires communities to leverage their efforts to meet multiple objectives and to do so in equity lens that counteracts existing patterns of vulnerability. This webinar episode will feature 3 CAP projects that consider co-benefits of nature-based solutions. And our first presenters are Benjamin Zaitchik and James Hunter with the Mid-Atlantic Regional Integrated Sciences and Assessments, or MRISA CAP team. They will share an overview of their equity-oriented multi-objective planning tool to support participatory adaptation scenario analysis through their case study in Baltimore. Back to the other slide, please. And Benjamin Zaitchik is chair of the Johns Hopkins Department of Earth and Planetary Sciences. He studies fundamental climate processes and applies this knowledge to problems of social concern. In this context, he leads several projects on the propagation of climate stresses through complex natural human systems, including work co-designed with community members. James Hunter is interim chair and associate professor of civil and environmental engineering at Morgan State University. His research focuses on urban stormwater management, green infrastructure, and climate adaptation. He is the MSU lead on DOE, NOAA, and NSF-funded climate-focused projects and contributed to the Northeast chapter at NCA 5. Welcome, James and Ben, and thank you both for being here with us today. And as a reminder for participants, please submit any questions you might have for them through the chat.
All right, thank you, Leah. We can go to this slide. Ben and I are with MRISA in the Mid-Atlantic. We can go to the next slide. And we're both in Baltimore, universities are both in Baltimore, and we have a focus on some disadvantaged neighborhoods, particularly with a neighborhood called Broadway East. And what we understand in Baltimore is we have a number of neighborhoods that have historically been segregated. And that's led to a number of these neighborhoods that are predominantly African American to be without a lot of green infrastructure and a lot of trees. You can click. So we're seeing here an example of the Broadway East neighborhood versus Roland Park, which is in the center of the city, or north of the city, where that is an area that is predominantly white, but as you can see, there is an abundance of green infrastructure and trees. You can go to the next slide. And so you can see the difference in tree canopy for these areas. You go click again. And this is leading to the Broadway East area and many of our predominantly Black areas to be under a lot of heat stress. You can click again. There we go. All right, next slide. And the other thing that's happened in Baltimore, we have a lot of blighted areas. This is exemplified in that Broadway East neighborhood with a lot of vacant homes. The city has really pushed to try and increase tree canopy with a goal of trying to get that to 40%. But there's also a need for additional green infrastructure. And as we look at redevelopment of these areas, we have a number of different considerations and constraints that we have to deal with, mainly with funding and where we can put some of these retrofits, and particularly how we can put this on public property versus private property, and then thinking of some of the other issues with regards to maintenance, and the amount of imperviousness, and not interfering with underground utilities. You can go to the next slide. And so we're looking at nature-based solutions. In a lot of respects, we're looking at adding green infrastructure, green stormwater infrastructure, with the idea that through this lens that we'll be able to address urban heat, stormwater management with regards to water quality and water quantity, and also help to reduce flooding. But we also understand that there are a number of different benefits that we get from NBS. You can go to the next slide. And so we have different options in terms of where we can put this green infrastructure, particularly if we take a watershed approach and strategically placing this green infrastructure in various areas. You can go to the next slide. And in the state of Maryland, we are focused on what we call environmental site design. So this is mandated by the state of Maryland when you have new development or redevelopment. So as we look at potential retrofits, this could include tree planting, but there are also interests in soil restoration, reducing impervious surfaces, along with implementing these practices in these neighborhoods with the targeted benefits of reducing stormwater heat mitigation, but also providing some other benefits, including aesthetics and improving land value and public health and well-being. Go to the next slide.
Great, so I'll take over here. Thanks, James, for teeing that up. So as James just indicated, we have a lot of different options and we have a lot of different criteria that we're going to be using to evaluate which are the best options. So how do you do that? And so the approach we're taking leverages some work that the Marisa project completed a couple of years ago with the case of extreme heat. So this is not yet green infrastructure focused explicitly, but we said, let's take a look at what we can do about extreme heat with a community-informed process dealing with multiple criteria. And we're using a decision-making under deep uncertainty framework here that's known as XLRM. And what XLRM does is it, first of all, identifies the fact that if you're going to come up with a solution, you need to know what the metrics of success are. And you do that collaboratively with communities. So those are the M in the process. You also need to work with communities to know which levers are acceptable. So some of those green infrastructure solutions that James just listed and other options as well. And then you need to know what your unknowns are, the X's. And so, we're dealing with deep uncertainty in climate, and also sometimes in terms of the effectiveness of some of the proposed strategies are also uncertain. And then you put that all together with the relationships to come up with potential pathways for community-informed, multi-criteria, adaptive strategies. If you go to the next slide, I'm just going to very quickly walk through what we did on heat. And so first of all, with the Marisa project, we have created very high resolution maps of air temperature across Baltimore. You can click again. We can then overlay those heat maps with a social vulnerability index, various range. This happens to be the CDC SVI shown here. And the areas that are popping out in bright red are those that are both unusually hot or anomalously hot and highly socially vulnerable. So those would be some focus areas. This includes the neighborhoods like Broadway East that James talked about at the outset. Click again. We can then integrate that with other kinds of data sets. For example, here we've got the Johns Hopkins Health System information on emergency department admissions for childhood asthma. And so by pulling all this together, we can then say, okay, can map out some of the scenarios of exposure, including future projections. We also know some of the levers that James talked about, and now we can get these metrics of success because something like reducing asthma admissions is a priority for these communities. And we work out those relationships. And if you click again, you'll see here just an example of a result for heat. And what the red stars here are showing are 4 different possible pathways, different kinds of investment strategies that could be made that address multiple metrics of success with respect to heat mitigation, health and outcomes, energy consumption, equity across neighborhoods. And what you see on the left-hand side is that there are a whole bunch of different pathways you could take. And this, over 50 years, what should we invest in? and that the more you spend, the more lives you save. And then the red stars, again, showing different ways of doing that, including some greening intensive pathways. On the right-hand side of the screen, what you see is that if you then say, okay, how many lives do we save on the x-axis? The y-axis is what's the equity of this? How are we saving lives in some of the poorer neighborhoods? You see a lot of scatter, and different strategies will give you different outcomes. And so that's a key concern here. And as we work collaboratively with communities on green infrastructure potential, a big concern all the time is saying, well, how do we do this in a way that really levels the playing field rather than putting greening sometimes where it's easier to put green, and coming up with solutions that maybe solve a stormwater problem but don't increase equity for the multiple metrics people care about. If you go to the next slide, a nice thing about doing it this way is that we can map this out to the neighborhood and say, well, what are we investing in each neighborhood for each pathway, where the reds here are just showing how much money would be spent over 50 years. If you click one more time, you can see that then you can say over time how much money is spent. So here's an example of a greening pathway, and says, well, in each of these neighborhoods of Baltimore, how much are we spending? And then we can also compare that to how we're achieving our metrics. And pulling that information together allows us to have an informed conversation with policymakers, implementers, and communities to identify pathways that really meet the objectives of a green infrastructure focused development. Everything I just showed is just for heat. Now we're bringing in the stormwater control. And so back over to you, James, if you click to the next slide to how we're doing that.
All right, thanks, Ben. You can go to the next slide. So we have an initial interest with regards to flooding. So we're using an open source software called CityCat that is allowing us to look at the entire city and also zero into certain neighborhoods to try and see where we see flood risk, and then what type of green infrastructure solutions that we can target to try and reduce that flooding, even though we do realize that green infrastructure won't be a silver bullet for solving all the flood issues. You can go to the next slide. So we're using this with the results that Ben's group is generating, trying to overlay heat and pluvial flooding and trying to figure out where we can target some of these practices. So what you see is the watershed where Broadway East is located, and it's allowing us to take that LRM process to try and determine where we can best place some of these green infrastructure practices. You can go to the next slide. And currently we're looking at the dots that you see there are the areas where we see flooding, either basement flooding or pluvial flooding. And we're trying to take these impacts that we see in a neighborhood, and again, combine that together and try and determine different practices that we can implement. You can go to the next slide. Go ahead, Ben.
Yeah, maybe we'll just sum up by pointing out that this whole thing has to be participatory. And so all of that under the hood work that James' team is doing on flooding, that my team is doing on heat, is already input to this multi-criteria process. And along the way, we're always working with these Baltimore stakeholders to identify what the proper metrics are, which levers make sense. And that's, I think, the heart of the process. And as we move forward in the next steps of integrating the flooding and heat to understand green infrastructure effectiveness, we'll continue this iterative process with communities and ideally have a workflow that scales. And so the solutions will be very specific to Baltimore because they're informed by Baltimore stakeholders, but the engagement and analysis process is meant to be generalizable. And we will stop there.
Amazing. Thank you both so much for presenting your work. So the second segment will feature Heidi Brown with CAP's Southwest team, Climate Assessment for the Southwest, or CLEMAS, who will discuss integrating public health and nature-based solutions. Her presentation will provide an overview of how health can serve as a motivator for adopting nature-based solutions. And Heidi Brown is an infectious disease epidemiologist and program director for the epidemiology program at the University of Arizona College of Public Health. She studies how environmental and social factors influence the spread of diseases in humans and animals. As an applied researcher, Heidi aims to create useful science through collaboration with community partners. And I'll remind everyone again that questions can still be submitted for Heidi and any speaker today using the question function. Heidi, thank you so much for being here with us today, and you are good to take it from here.
Thank you very much. It's great to be here, and I really appreciate being able to talk about our work. If I could get the next slide. So as you mentioned, I'm in the field of public health. I'm interested in human health, and that's really my motivation that inspires the work that I do. Next slide, please. And so you mentioned CLIMAS. We're part of CLIMAS, which is Climate Assessment for the Southwest. And CLIMAS has been continuously funded since 1999, so we've been around for a while. And it's a partnership with NOAA, the U of A, which is where I am, and then New Mexico State University, and as of 2022, also the Intertribal Council of Arizona. And one other thing that was kind of new for 2022, even though we've thought about some of those environmental health hazards, one of the things that we explicitly did in 2022, if you can tag the next slide, please, is to insert health into the way that we were thinking about the different projects. I think this is an animation, sorry, so one more click. And really that's kind of thinking about vector-borne diseases. We live in Arizona, so if you've heard of Coxsackie Valley fever, that's another disease. And just kind of trying to think about that. Ben mentioned heat. We also think a lot about heat out here out west, as well as wildfires. So thinking of them both from the environmental and from the health aspect. Next slide, please. And so, of course, totally biased from my point of view, is health sort of that way forward? Does health kind of change the way that people can start thinking about and addressing these issues? Next slide, please. And so one of the things that we started doing is kind of thinking about those code benefits. So we talk about mitigation policies, those policies that will happen or that hopefully happen in order to mitigate climate change, to really change the environment and change the trajectory that when you see those sort of graphics of the directions that we're heading, what are those mitigation activities? And co-benefits kind of thinks about, well, if I engage in something like commuting, which, you know, changing the way that we commute, taking public transportation or riding bicycles, you know, we're reducing carbon emissions, but are there also sort of ancillary health benefits that come from that? And can we start to quantify those and think about those and use those as a potential motivation? Next slide, please. And so one of the first places that we started was to try to understand, you know, like what are people thinking about? And other people have done very similar work, and there's some great work coming out of both Yale and George Mason University that's looking at like what are people thinking about, sort of tapping into what folks are thinking about in terms of climate change, in terms of their ability to modify and to change and to have control of the situation. And we did a national survey, about 500 people ended up participating. We tried to get more responses from out west because that was the area of interest. And we were looking at like, what is, you know, if you get a high efficiency vehicle or if you install solar panels, what's your motivation? And for a lot of us, economics is the motivation. For some of us, environment is also the motivation, but for very, very few of us is health the motivation. And you're probably thinking, well, yeah, like I can't really think about plant-based diet. Yes, I can think of reducing red meat, and everybody tells me that's better for my health. But why would riding my, you know, like why would taking public transportation be better for my health? And that's really the place that we kind of want to interact and try to get people thinking about, well, what are those co-benefits that might be engaged? And next slide, please. And what's really interesting about that, and again, this is from our survey, but others have shown it as well, is that when it comes to thinking about the health problems or concerns with global warming, we trust our primary care physician. That's the most trusted person, more than like EPA setting standards, more than the WHO, more than our local public health organization, which is probably the person, you know, like where we're getting most of the information that we're seeing. But really that trust is something that we build with our primary care physician. So then that gets us, next slide, to kind of think about, okay, well, how do we team up with public health and think about like how empowered are physicians to have a conversation? And what we found is that, well, not very. And so this is a collaborative right now that we're working with College of Medicine, so human physicians, also veterinary medicine, because a lot of us get quite a bit of our healthcare from when we're talking with the veterinarians. And that also bringing in that One Health, that aspect of like, how are these interconnected? And then trying to get to the point of empowering. This was a quote that we had from a medical student that said, like, I don't know how to, like, I want to have that conversation, but if somebody talks to me, I don't know how to have that conversation, which led us, next slide, to create some help and really just to take those things that we might be thinking about as, oh, well, that's a climate change issue or that's a health issue, and try to merge those and try to understand, like, how do you connect those and how do you make those connections? On the next slide, please. And one of the other things that's really important, and this came from when we were talking with our communities, is, we can think of those things that we typically, oh, well, that's innately good, right? If I put more trees, then that's good. But there are some populations that are worried about, well, the other side of it, because out here, when we think about trees, we think about, well, who's going to water them? And when you think about watering things, you start thinking about pooling or creating potentially microhabitat. And in my world, microhabitat sometimes means mosquitoes. And so one of the other important pieces of it, next slide, please, is to think about and to consider that we might also be having maladaptation. So when we're thinking of inserting, how do we ensure that we're not creating a new problem or a different problem? And recognizing that that's something that's sort of NIMBY, not my backyard, right? So yes, I like this idea of green infrastructure, but not mine. And so this is one of the ideas that we had, and this is some of the typical ways that we kind of think of installing green infrastructure out here in Arizona to collect that water, because it's a precious resource. Next slide, please. But it's also a precious resource that might inadvertently end up creating habitat in which we kind of think about mosquitoes collecting. And so there's some pictures of a basin or just a curb cut that gets the water to not run into the street, but to run off into and then soak into the groundwater. And so next slide is we looked at, we had a bunch of students. It was a really neat collaborative project working with, if you saw in the previous slide, you don't have to go back. It was City of Tucson, Tucson Water, it was Vector Control, Pima County Health Department working with Vector Control, and a bunch of students with, I think it's 3 or 4 different colleges across campus to go out and sample in these areas. And so we had 28 sites that were visited multiple times in one summer. Notice the dates. The next year is what we called the non-soon. We didn't have much rain the following year. And then the year after that was COVID, so we weren't able to replicate our study. But nonetheless, for this one year that we were out there, pretty much we were out there at least no more than a day. We started sampling immediately after a rain event. And for the vast majority, we did not have any accumulation counted. So it really quickly absorbed into the ground, did exactly what the green infrastructure is supposed to do. But one basin didn't. And this is a picture of it. And it was really kind of interesting, and it gets to that idea of maintenance matters. So how we build it and what we do with it really matter. When we go to install this infrastructure, are we sure that we're taking care of it? And as soon as we talked to the colleagues in the School of Architecture, they were like, well, it's a shaded area right next to a garage. Yes. And that's exactly what the issue was, is that this area, it got the runoff from the garage and it was shaded, so it didn't dry out. And we actually did just once manage to find a West Nile virus vector larva of. So it didn't fully emerge, it didn't get to pupate, but we did find that there is that potential, if these sites aren't maintained, that we might end up creating additional issues that we want to make sure that we're avoiding. Next slide, please. And so that's really what we're trying to integrate into it, is as we look at health as a potential way that we kind of think, of bringing forward and integrating that piece of it, looking at it from both sides, seeing that public health physicians can be a trusted source, but we want to make sure that they're prepared and ready to talk about it, but also to recognize that, we can't avoid the conversations about potential maladaptation as we're doing some of these projects and kind of thinking our way through the adaptations that we're doing. Next slide. And so I think what we've noticed, and as we dive into it, as we think about these different mitigation activities, those health impacts are broad. There's a lot of them, next slide please, that we can think about as something that we need to address, but we really need to think about how we disseminate that beyond just academic papers. So those learning modules and integrating with the community and trying to make sure that we're getting that information out, working across different disciplines. Next slide. Can be really helpful to making sure that we're kind of beyond that. And finally, thinking that we do have an untapped sort of place of thinking about health as not just an outcome, but also a motivation, that there's ways that people will think about climate that might be different when they're thinking about it from health, as opposed to when they're thinking about it from other maybe less tangential ways, or places that they feel they have less control over. Next slide, please. I think you might go ahead and hit it twice because I think this is my final animation. Thanks. And so really, again, just back, not quite so far, just thinking about those resources and integrating and making sure that the information is disseminated, not just through academics, but also to our partners through reports, but also making sure that it gets out into those communities that can most benefit from it. And I think, well, we just saw it, and that's my last slide, and that finishes me for now. Thank you.
Thank you so much, Heidi. And for our final speaker and presentation, we'll have Omar Gates with the Great Lakes Integrated Sciences and Assessments, or GLISA, our CAP Great Lakes team, present on the steps taken to support a community's needs related to stormwater management. And Omar Gates is a climatologist with GLISA at the University of Michigan School for Environment and Sustainability. His work focuses on providing climate data expertise to various researchers and practitioners in the Great Lakes region. As GLISA's tribal liaison in his other role, he helps integrate climate science with indigenous knowledges for the adaptation practices of Great Lakes tribal nations and organizations. Omar, thank you so much for being here. And again, questions can be submitted using the question function. And Omar, you're good to take it from here. Thank you.
All right. Thank you, Aaliyah, for that introduction. Next slide, please. So, if you can go back one slide, please. Thank you. So, hello, everyone. My name is Omar Gates, climatologist with GLISA, and today I'll be talking about the Climate Connect partnership. With this, the presentation will be focusing on how a community-led effort led into much broader adaptation for this specific event. Next slide, please. But before we get into all that, I would like to first introduce you all to GLISA, the Great Lakes Climate Adaptation Partnership. With GLISA, we are a collaboration between the University of Michigan, Michigan State University, the College of Menominee Nation Sustainable Development Institute, as well as the University of Wisconsin-Madison. For what we do, we're primarily translating science to decision-making, whether that's through looking at investigating emerging climate issues, facilitate collaborative activities, translate and tailor available climate information, as well as develop and implement different resources and tools that are relevant to our region. Next slide, please. So now that I've given you a brief overview of what GLISA is, let's talk more about the Climate Connect partnership. With this partnership, it was based upon the effort of addressing the well-documented history of environmental and health impacts in Southeast Chicago. From this, the partnership was co-created by the Alliance for the Great Lakes, as well as the Southeast Environmental Task Force, to address these impacts, whether it was from air pollution or from water quality issues as well. From this, the initial group focused on zoning and industrial changes along the Calumet River, but as we go through this presentation, we'll talk more about what are some of those efforts that have evolved into something greater. Next slide, please. So with this is just a brief timeline of some of the major events that occurred as a result of the partnership with its formation in 2018. In 2019, the partnership approached us at GLISA in order to be part of our small grants program. With the small grants, GLISA provided funding as well as different resources to the partnership in order to help them with working with different communities as well as trying to get community participation. In 2021, we have the official release of the Climate Connect Data Book, which was a compilation of qualitative and quantitative information based upon the research and the results from the partnership. And from this, as we go into 2023, this is where one of the major victories occurred, in which the Chicago had its voluntary compliance agreement based upon the results from the U.S. Department of Housing and Urban Development's complaint. But a little bit more about that later on. Next slide, please. Going back to the Calumet Connect data book, this again was a compilation of that qualitative and quantitative information. But with the quantitative information, we saw that much of the data highlighted some of the negative health impacts occurring within the Calumet Industrial Corridor. Some of these takeaways included seeing higher rates of coronary heart disease, as well as chronic obstructive pulmonary disorder or disease, or COPD for short, being affected many residents in the Calumet Industrial Corridor compared to the rest of Chicago. From this, other study research findings were that this area was most medically underserved compared to the rest of the city, and this was as a result of toxic releases coming from negligent companies. On the qualitative side, this is where we saw the whole entire thing of seeing the community voices being heard, in which they voiced their concerns, saying that because of the lack of appreciation, representation, especially in terms of policies, they felt that they weren't at the table in terms of deciding what was going on in their own neighborhood. From that, another takeaway was just limited residential trust, whether it was looking at the adequate health protections that were in place, not addressing enough of those concerns, and so on and so forth. One major recommendation from the document overall was that it did say we must prioritize residential voices. From that, as a result, as we go throughout the rest of the presentation, we'll see what the result of that prioritizing of residential voices occurred. Next slide, please. In terms of one of the products that Gleesa created as a result of the partnership, I'd like to introduce you all to the health impacts in the Calumet Industrial Corridor's two-pager. With this two-pager, it highlighted some of the temperature, precipitation, and air quality trends that we saw in the industrial corridor. And this is working with many different practitioners from the partnership, especially from the Department of Public Health, as well as other community organizations. From this document, I should say, highlighted some of the trends that we saw in temperature and precipitation, especially those extreme precipitation events, as well as looking at air quality and some of the pollutants that are of major concern for certain populations. In future iterations of the document, we did add a glossary in order for residents to understand some of the more technical terms. Next slide, please. So with that, there were major recommendations and outcomes that came as a result of this partnership and the work from the Calumet Connect data book. Some of those included looking at 30 different interviews conducted with head community figures in order to broaden and strengthen the connections between the coordinating group of the Calumet Connect partnership, as well as with youth leaders within the community. From here, the partnership did also provide hands-on experiences where community members were able to walk around certain areas around the industrial corridor in order to say, like, hey, I would like to see this change, or hey, we can add this, for example. But one of the major victories from this work was the landmark civil rights HUD complaint that was brought to the city by community members. And this HUD complaint did focus on equitable land use and zoning reforms within the industrial corridor. As a result of this HUD complaint, the city of Chicago did announce a cumulative impact ordinance focusing on making improvements based upon the findings from the Calumet Connect data book itself. And from, you see on the side here, these are some of the documents that came out of that work as well, in which we had the advocacy guides, as well as frameworks that were being implemented for future work. Next slide, please. Going back to those community-led experiences, there were 3 significant events that came out of this work. One was 100th Street Calumet River Access, where residents went in and just walked around their own neighborhood, just looking at where places there can be for improvement, whether it was implementing more green infrastructure to try to avoid more flooding prone areas, as well as having to say, this is what we should add, or this is what we should be using in order to address some of the impacts we're seeing. Another type of tour was the walking tour in the Shroud precinct, in which residents will be able to provide their feedback in order to say, this is what we want to see. And ultimately to have that face-to-face interaction with experts as well as decision makers. There was the People's Town Hall, in which residents came in, viewed some of the different research findings and different things from other experts, excuse me, and also listening to panels from decision makers in order to say, we are listening, what is it that you want us to do? Next slide, please. So ultimately, because of that HUD complaint, the City of Chicago did comply with its voluntary compliance agreement. From here, they made environmental justice the focal point of this work, in which they made the cumulative impact assessment. With this cumulative impact assessment, it took upon the recommendations and findings from community members in order to say what were the priorities need to be done, as well as a result of this work, some of the environmental justice index scores that were done not just only for the Calumet Connect or Calumet Industrial Corridor, but also for the rest of the city. And for the map that you see on the right, this is just an EJ score, or the Environmental Justice Index score for the entire city, where blue areas are signifying most prone areas compared to, say, the lighter colors that you see here. And with the red block, this is just showing you where the Calumet Industrial Corridor is located. So with that, this is one of the most prone areas based upon those environmental justice indices. Next slide, please. So as stated before, as stated in the description of this presentation, the whole entire work with the partnership ultimately started with working with the DPD and the Department of Public Health, but also with future work, they're starting to modernize and try to implement more strategies where they're looking at that environmental justice lens. Most of this includes looking at trying to implement more green infrastructure, as well as trying to figure out ways in which stormwater can be less obtrusive or less impactful to the overall corridor itself. From this, additional things that the partnership is working on is focusing on advocating more local and state policies. With these local and state policies, they're trying to help the city be able to acknowledge past grievances by identifying limitations in current policies affecting some of the citizens. And through that EJ-focused lens, they're trying to make sure that all voices are being heard. Another thing that the partnership is working on are direct funding opportunities, because of past events, some communities have not had the opportunity or the funding in order to carry out some of these nature-based solutions or some of these different things. So with that, the partnership hopes to be able to directly funnel money towards their efforts. Next slide, please. So in summary, this is something that has been a community-led effort rather than just say an organization or a governmental agency coming in. From this, the Calumet Connect partnership was a formation of two different organizations, but it made the community voices heard, especially where residents were able to identify concerns about their community and their environment, but at the same time be able to say, hey, this is my experience, these are my stories. How can we improve these situations based upon my own experience? And with that, with GLESA's part, we provide their climate information and the facilitation guidance, but with this partnership, they're the ones that actually led all of this effort. And also because of that effort, they were able to show an example of having that community insight and engagements being vital, especially when trying to bring together different residents, institutions, and agencies to focus on one particular goal of just trying to make everything equitable and be able to have that center or that focal point of environmental justice in the long run. So with that, next slide, please. I'd like to thank you for your time and consideration. And to learn more about this project as well as others that GLESA has provided, please feel free to visit us at glesa.umich.edu, as well as contact us at glesa-info@umich.edu. Again, thank you for your time.
Thank you so much, Omar, Heidi, James, and Ben for sharing all your research findings and insights with us. It was a great series of presentations. As a reminder, you all can submit questions to our speakers, and yeah, it looks like everyone's sharing their video. So Jeannie, please take it away to conduct our question and answer session.
Thanks, Aaliyah, and huge thanks to Ben, James, Heidi, and Omar for sharing your super interesting work with all of us today. So now for the Q&A portion of our agenda. We've received a number of questions already through the question function, but folks, please feel free to continue submitting questions as they arise during this discussion. So the first question I have goes to Ben and James, and someone in the audience was wondering, has there been any pushback from local governments or other community members on urban greening in Baltimore due to concerns around safety or maintenance?
Yeah, sometimes there is some pushback. Um, there were efforts sometimes where the city has suggested some practices, but the community has pushed back. Sometimes there are concerns with mosquitoes and other maintenance issues. So those are certain things that the Department of Public Works needs to overcome when those issues do happen. Sometimes there's some people who are upset because trees are sometimes coming down on people's cars. So the care, I think Heidi was mentioning, maintenance of those practices become very important to maintain the quality of those practices.
Thanks, James. Ben, did you want to expand on that at all?
No, I think James covered it. That's great. Thanks.
Okay, thank you. Okay, so my next question is for Heidi. You spoke to some of these maladaptations of green infrastructure, mentioning potentially creating habitats for mosquitoes as an example. I was curious, are there any other maladaptations of green infrastructure that you have explored in your research or that you've seen kind of in the broader body of literature that you find important?
Well, I of course go to the mosquitoes because it's my area of research. But I think, James, that previous question kind of points directly at it, doesn't it? Which is when we do, like it might be that we get pooling of water and so we end up with mosquitoes or potential for mosquitoes. But even when we were talking with Tucson Water, some of the communities were making comments about just debris, because it washes in and then all of a sudden what was a nice curb is a curb with debris in it, or trash can wash into it. So we do get that where people have those concerned. And I think it goes back to just like James and Ben, well, James answered the question was saying, is it's really that maintenance, and that has to be factored in. It's one thing to install the green infrastructure, and then it's the other thing to plan on, well, who's going to maintain. And Tucson Water had a lot of conversations because they ended up going with they would install it for the communities, but then the communities were responsible. And that did influence sort of the way that people, what they wanted in their community, and how. And I think it kind of goes to the recognition that yes, that might be an adaptation, a maladaptation, but if we plan for it, here are the things that we can do to kind of watch for it and be aware that this might be something, but it's something that can be controlled.
Got it. Thank you, Heidi. So the next question is directed to Omar. It was really great to hear about the success that your team had working alongside the community and with the city of Chicago in making environmental justice a central focal point for the Calumet River corridor and the planning efforts there. Has there been any sort of post-project evaluation work done to learn about sort of the longer-term attitudes of the community members that were leading this work? Are folks still feeling like they have kind of ownership? And are you still feeling like the partners involved feel a lot of community buy-in for this work?
Yep, thank you, Jeannie, for that question. Yes, so I would say there is still ongoing engagement with the community impact assessment, for example. we were seeing that based upon the recommendations, they were taking that information from community members and having specific teams taking that feedback as well as seeing like where can they make improvements. For just interaction with like the city itself, this is where the whole entire voluntary compliance agreement came in which they were establishing different departments, whether it was the Office of Climate and Environmental Equity, which came as a result of this compliance, as well as trying to have that whole entire involvement from the different partners, whether it was having that environmental equity working group or WG, for example, that was part of the community impact assessment, but also feeding into other types of plans within the city, whether that was the healthy impact plan or the health plan, as well as different efforts from DPD and the Department of Public Health.
Wonderful. Thank you for that answer, Omar. We're getting a lot of questions rolling in here, so we'll just keep it moving. This next question is going to be directed to all panelists, and this is a question that Heidi spoke to a lot in her presentation, but I'm curious if each of you could describe what your partnerships with local health practitioners might look like in practice. Or if you do not have, current partnerships, how you would envision them to be beneficial to your work moving forward.
So I spoke to it, so I'll go quick, which is one, I'm at an academic university. I'm at a university, and so the sort of one of the easiest places to connect is in the education. Although there's challenges of working across colleges because everyone has a different schedule, but that's one of the places is to really sort of infuse it in the education as it moves forward with the ideas that when they're then practitioners, they're tapped into this idea of kind of thinking about climate change, thinking about communities, and thinking about those sort of partnerships. So that's the easy answer. Sorry, folks. I'll leave the harder ones to everybody else on the panel.
No, I think that's a great point, right? It's an advantage that we have at the universities. And a complement to that is working with the clinician researchers themselves, right? So very often our question space can be informed by working with some of these clinicians who can channel the concerns of the community and identify some of the patterns they've seen, and can also provide a gut check on some of the results, right? So when you do an analysis of the data and come back to them and they say, well, that either does or doesn't track with what I've seen as a clinician, and that can be anecdotal sometimes, but I think it's still very informative. Those same clinicians then also become a vehicle for communication, right, with the community, because of course they're very trusted voices. So I think that's something that we really benefit from and hope to continue those relationships as the project matures.
Yep, and I'll just speak briefly on some of our current work with the Michigan Department of Health and Human Services, where we're working on updating some of the information where we're connecting public health and climate information together in order to inform some of the decisions for the state of Michigan. With this other things that are happening as a result of that collaboration is engagement with communities throughout the state in order to have them apply the climate information, the public health information into their own works as well.
That's great. Thank you for all of those responses. We've got just 2 minutes left, so I'm going to pose one final question to the entire panel, which is, how do you envision the findings of these projects being applied in other regions or communities? And do you have any recommendations on implementing the lessons you've learned throughout your work?
I might just jump in on process, because this participatory multi-criteria approach we're taking is incredibly time consuming and incredibly locally customized. But I think with that, we're hoping to really demonstrate its value. And I think our project kind of believes in this principle that you can only make robust green infrastructure decisions if you do this in this multi-criteria participatory way. And that framework, I think we heard it, I think it already cuts across all the projects we heard about today, because this is an understanding that we need to move in this direction. And if these projects can yield these frameworks and processes for participatory policies on green infrastructure, I think that's going to be a rapidly scalable set of solutions.
Thanks, Ben. Does anyone else want to have the final word to respond to that question? Omar?
Yeah, just briefly saying that as throughout most of these, or throughout all of these projects, having that community buy-in is important, because without it, you're just having that maladaptation, and at the same time, just missing some of the point, just missing the point ultimately.
Thank you. And I think that's a fantastic point to end on. So huge thank you again to all of the panelists, and I'll pass it back to Aaliyah to wrap us up.
Yeah, thank you everyone for joining. Ben, James, Heidi, and Omar, thank you for participating and sharing your work. And to everyone that joined us today online, please mark your calendars for our next webinar on Thursday, January 23rd, to learn about challenges and opportunities of scaling nature-based solutions for climate adaptation. Thank you again, and take care.